Good evening, everyone. Thank you all for joining us. It's January 24th, and it's good to be with you again on another virtual town hall, Living with Lupus and COVID-19 in our community. And as always, I want to thank our co-sponsors, the Lupus Foundation of America Georgia chapter with Terry Iman, the Georgia Council for Lupus Education and Awareness, and the Division of Rheumatology at Emory, which also heads the Georgians Organized Against Lupus research cohort. And this is, as always, a reminder that you should take all the information that I give you today and not specifically apply it to yourself without consulting your own medical team. So these are numbers that I usually start with, and these are cumulative numbers to date. So from the entirety of the pandemic, you see the burden throughout the world nearing 100 million infections. It's really difficult to put your hands around that. And then over 2.1 million deaths. And you see the US remains tightly or strongly in the lead, followed by India, Brazil, Russia, and the UK, and a lot of other European countries. This is a heat map of the world, and this represents where most of the new cases have been in the past week. And you can see that the deepest red or magenta color represents where the cases are the highest in terms of new diagnoses and new infections. And it remains so, especially in the US and then parts of Europe. But also South America is still very hot, and then parts of the African continent, especially near South Africa. So a few points since the last town hall a couple weeks ago. The US has gone through some big changes, as we all know, especially politically, and that has impact in how we are acting with partners throughout the world in terms of the response to the COVID virus. And the US will now join the international organization WHO and their initiative to ensure equitable access to COVID-19 vaccines and treatments around the globe. And I'll touch on that in a minute. Now, I'll also touch on the new executive orders and the national strategy that President Biden has enacted. We have more than 120,000 individuals with COVID that are currently hospitalized still. And along the vaccine front, and we'll talk a little bit more about vaccines in a minute, Johnson & Johnson is yet another company in the area of vaccines. And as we know, not only because of the limited number of supplies that have been able to go out, we need certainly more options in terms of vaccines available, but also different ways that they're given and frequencies and how they're stored. So options are a good thing. And with Johnson & Johnson, their vaccine does seem to be generating the proper immunity and is demonstrating safety. And so hopefully it'll get approved soon and it'll be another option for us. And what's also great about Johnson & Johnson's product is it's only a one-shot vaccine. Can you believe it? It's been a little bit over a year since the first case of COVID-19 was identified in the US, and has time flied, and hopefully it'll fly faster so that we can move beyond this rough time for us, especially in this country with the pandemic. And this is what the heat map looked in terms of new cases in the US a couple weeks ago when we were last together. And this is the current heat map. And the difference is that there are less areas that are in the dark red, and that's good. We continue, however, to see a lot of reddish hue, especially in the southwest, along in California and Arizona especially. But again, in the south in general, especially in our area, and you can see a lot of concentration around South Carolina and up the East Coast into New York and Massachusetts. It's still a big issue, but the colors definitely look better from the last time when we were together. And that bears out in these graphs and numbers here. This is national figures, and you can see in the upper left, new reported cases by day, and you can see that it's trending down. But again, keep putting it into context. It's good that the direction is going down, but it's still at a very, very high level, higher than it's ever been in the pandemic. So we continue to be in a very precarious state, but heading in the right direction. In terms of deaths, as we've talked about previously, the deaths lag a bit behind the new cases. And so we don't see a particularly positive trend in terms of the deaths yet, and we don't expect to. But we are also seeing a positive trend in the hospitalizations across the country, that it seems to have hit its peak and is going down. And this is all in line with the effects of the winter and Christmas holiday season. So we expected this, and we're starting to see improvement, but we're still going to be in a world of hurt for a while, at least through the next few weeks. And the deaths probably won't start coming down, as I've said before, for at least another couple of weeks or so. But let's continue to focus on the positive, and it's good that we've gone through at least the peak in some of these areas. Certainly the number of cases have gone down a lot, and the deaths and the hospitalization, it's showing signs of positive trend. So when we look at parts of the country that are really severe in terms of the outbreak, as I alluded to in the map a couple slides ago, Arizona and South Carolina really seem to be the worst of the worst. But let's not lose the forest for the trees in acknowledging that the rest of the country remains at still a very high level, but fortunately heading in the right direction. And similarly in Georgia, this is what the map looked like a couple weeks ago when we were together, very dark red throughout the state, and this is what it looks like now. Still more red and orange than we would like, but again, heading in the right direction overall. And it bears out in terms of the individual graphs that we see here. In terms of the new cases, you can see that it's starting to come down. And reported deaths, as we discussed before, will probably continue to rise for at least another couple of weeks before we see it come down. And also, fortunately, in Georgia, we're starting to see that we're passing the peak of hospitalizations, and still a lot of variability based on the area, but overall as a state, it's good to start seeing some positive trend here as well. Another way to look at all of this is this dashboard from the COVID Act Now website. And at the top is what the dashboard looked like a couple of weeks ago, and at the bottom is what it looks like now. A couple of weeks ago, we were at the very highest level, and now we're just at the level below that. And you can see along all of the different parameters here, the daily new cases, the infection rate, the positivity rate of the tests, and the ICU capacity that's being used. All of it is trending in a favorable direction, but still at a very high level. So with the new administration is a whole new perspective and kind of how they go about approaching the COVID virus and tackling it in terms of a national standpoint. And it's clear that this administration views it as a high priority to do a coordinated federal effort and to support the states to a higher level. And so to that end, the Biden administration has really approached this in terms of viewing it like a wartime effort and has called for um, centralized and focused efforts along various lines. And along that, he's signed various executive orders right from the very beginning that you can see listed here, and that some of that I've mentioned before, really underscoring just the federal focus. And it's really night and day compared to the previous administration. So it's going to take some time to trickle down, but at least we have a lot of attention at the highest national level. And I know that that will then translate to better coordinated care. But it's a very complex system. We have a lot of ground to catch up, and we need everybody's help to get there. But along the different things that he has done with this new administration, we have positions to really coordinate the effort on a national basis. Like I said, we've rejoined the WHO. We're requiring masks and distancing on all federal properties and by federal workers. The Defense Production Act has been utilized to engage industry to fill supply shortfalls with regards to needles and protective gear and masks. There's a testing board established to coordinate efforts to expand testing. We'll bolster access to care and treatments, and improve collection of data, provide guidance in terms of reopening schools on a national level, having more guidance on a national level in terms of keeping workers safe from COVID, requiring face at airports, and establishing a health equity task force, which is going to be extremely important in terms of tackling the virus, especially in this country where there is a lot of inequity. But we also need to be reminded that the equity also lies on a global level, because what we're seeing in the maps, and that's one of the concerted efforts that I have, is to start by presenting you information on a global level. And some of you may ask, well, why do I care what's going on in Russia when we're having problems here? The virus doesn't know boundaries, and you're seeing how quickly it spreads. The world that we have now is much smaller than it was in generations past, and especially how transportation can occur, how mobile we are as a global community. The viruses can move very quickly. And so that really is along the lines of us being reminded that we are global citizens, and I think this approach on a national level is a good thing. We certainly need to do better in this country, and I can understand why we're focused on the needs of what we have in our state, in our community, and that's very important. But if we do get everybody immunized in the US, it's really not going to mean much unless the rest of the world is reasonably caught up. And there's a lot of disparity that we're seeing. Israel has already inoculated over a third of their population, but the rest of the world is still very far behind. And if you look at total vaccine administration, the US has accounted for a third of the vaccines that have been distributed worldwide, even though we haven't nearly reached the levels that we thought that we would be at this point in our own country. So some quick take-home points at this juncture, that just to remind you that January and February will continue to be rough. The trend will be positive, but there's a lot of people suffering. There's a lot of people in the hospital, and it's certainly not a time to let your guard down. Even if you get vaccinated or you've recovered from COVID, there's a lot that we need to do together. But the hope is there that things will get better. It may not be as quick as we want it to be, but they will get better. And we'll continue to talk about that. Switching to the vaccines, and that's certainly the biggest topic these days. I want to bring up this committee. It's the Advisory Committee on Immunization Practices, the ACIP. It's a work group of several members that meet very regularly, and their current goals are listed here in the bottom left. They're focusing a lot on allocation and who should be considered and when. Uh, but they've done a lot of work before, and I wanted to highlight something that I personally had missed, and I haven't read anything along these lines for lupus. Some of you who are definitely more astute and um, very aware, much more than myself, may know this, but I came across their general recommendations at the ACIP, and there's a section there on immunocompromised conditions and autoimmune conditions. And I'm going to address some questions that have come up there that keep coming up that are very important questions along the lines of having lupus, which obviously is an autoimmune condition, and with the medications that we often use to treat lupus, uh, many are immunocompromised. And so the question of what should I do as someone living with lupus and the vaccine? And the bottom line is we still don't have a very clear-cut recommendation yet specific to lupus, and it's going to be a while, but we have some general recommendations. And I think this is about as good as we can get for now. And so I'll kind of point out what they have, at least officially, under the ACIP recommendations. Now, first at the top, it talks about immunocompromising conditions. And they did point out that people with stable HIV infection were included in the vaccine trials. Now, this is far from lupus, but it does give you a sense that the way we know the vaccine works, they had enough confidence to include people with stable conditions like HIV that are immunocompromising. But they do acknowledge that it wasn't a large portion. There weren't enough people in the studies to make it conclusive, so the data remain limited. but given the fact that they didn't see a major signal in safety, they had reason to believe that it was safe in immunocompromised individuals, specifically stable HIV patients. They list here that immunocompromised individuals may receive COVID-19 vaccination if they have no specific clear reason not to be vaccinated. But there's all the caveats that you're going to continue to hear. And this is, I know, what really frustrates and vexes some of you, that you want to hear, yes, you can take it, or no, you can't. But I don't think we'll get there. And you just have to use this information with your healthcare team to the best of your ability. We just don't know about the vaccine safety profile and effectiveness, specifically in immunocompromised populations. But the feeling is generally sufficient that at least the ACIP has put out this statement that clearly says immunocompromised individuals should be considered, and there's no warning to have people be more cautious than the wording is here. Now, in terms of the autoimmune conditions, I'm sorry, this part here is about how we just don't know about, we need more information. And so this is what we're going to have to live with all the statements that we have, is there's caveats. We just don't know for sure, but we feel this way. And so they're saying that the immunocompromised conditions are probably safe enough, but we don't know completely. So the autoimmune conditions here, they're, and I didn't realize this on first glance of the papers, that there was no specific exclusion of people with autoimmune conditions in the trials. It doesn't mean that there were enough of them in there. I'm not aware of anyone with lupus specifically in the trial or what happened to them. Maybe there was, but I don't know. But as a whole, having an autoimmune condition did not prevent someone from entering the clinical trials that got the vaccines approved. And apparently there were some. I just don't have the specific information as to how many there were and what type of autoimmune disease they had. But the ones that were in there were no imbalances, is the word that they used, observed between symptoms consistent with autoimmune conditions or inflammatory disorders, meaning they didn't see any major flares of the autoimmune condition between participants in the vaccine trial that actually received the vaccine and the group that had placebo. So there wasn't a strong signal with the limited number of patients with autoimmune conditions in the trial to indicate anything worrisome about giving the vaccine to autoimmune patients. So again, the general recommendation was they're open to it. Persons with autoimmune conditions who don't have a very specific reason not to be vaccinated may receive the COVID vaccine. They're not saying you should, but they're not saying you shouldn't. And so this kind of mirrors the tone that I've been trying to have, and I think is the best that we can do for a while, is that, you know, based on what we know of how the vaccine works, of all the vaccines that people with lupus are able to get in the past, there's no obvious or strong reason to think that the COVID vaccine is going to be particularly worrisome. But again, the caveat is we don't have specific information on lupus. There are studies planned. The results are not going to be back for a while. I don't believe any of them have really started yet. So we're talking months from now, if not a year plus. So you're probably going to have to make a decision before you have the full amount of information in hand. Much like everything else during the pandemic, we're just going to have limited information in this case as well. But I'll continue to point out that there have been a lot of doses administered, not enough, obviously, but there have been 16.5 million doses administered as of Wednesday. There were only 165 emergency room visits reported as of Friday from people who received the vaccine. That's 0.0013%. That's not 1%. That's not 0.1%. But that's 13 10,000ths of 1% of doses administered. And we don't even know if these all of these cases were related to the vaccine. This is just in the database that the CDC has. But worst case scenario, let's say we assume that all 165 were related to the vaccine. It's still an extremely small percentage, much smaller than the side effects that many of you are already accustomed to the medications we give you for lupus. So put that into context. The mRNA vaccines that are available now from Pfizer and Moderna have molecules that just stay in the body for a very brief period of time. And the trials were done in an extremely transparent fashion with diverse populations, which is what we could not say for the vast majority of clinical trials in lupus and in other conditions before. So they were in a lot of different people, different parts of the country, and it showed excellent safety and efficacy. So we are in phase 1A of vaccine administration in Georgia. You can go to the Georgia DPH website to look specifically at what these phases are in terms of people eligible to receive the vaccine. Again, having vaccine is one question, but separate from that, people who are eligible at this time to receive vaccine are healthcare workers, long-term care facility staff and residents, those 65 and older and their caregivers, and specific frontline workers like law enforcement, fire personnel, uh, and people in those areas. So we have not gotten past this phase. I don't know when we're going to go to phase 1B, but just to look ahead, the next group of people that will become eligible, it will happen. But obviously there's a little delay. We're talking about essential workers who are non-healthcare, who perform jobs across critical infrastructure sectors. I think these are people that are teachers, that are grocery workers, that are working face to face often with the public and are at high risk and doing a wide variety of essential jobs. So this is a huge number of people and a very important group. And we're aching to get to this level, but we haven't even vaccinated significantly the proportion of people that need to be in 1A. So that's really what the hubbub's about lately, is just trying to get the system to rev up, get to this point, and so that we can even go to 1C, which are people 16 to 64 with medical conditions that increase the risk for severe COVID. And that will probably be most of the people with lupus in our community, those within this age group that don't fit in any of the other age groups that are in 1A and 1B. So we still have many steps to go, but we're working very hard to get there, and we just need to make sure that all the systems are working. So keep an eye out. We'll see how things go over the next few weeks, but it will get there. It's just a matter of when, and that's the big question for many of us. So be patient. Things are evolving. We are learning more about the virus and vaccines each and every day. A year has passed since the first known virus was landed on our shores, and think how far we've come so far. And it's only been a year with a very complicated issue. And we're going to learn even more in the coming months ahead. So we just need to be safe, mask, social distance, wash our hands, do the things that we've been taught all along, that I've been telling you are the basics of what we need to do, regardless of what happens with the vaccines or anything else, and allow these steps to occur. Knowing that there's uncertainty, there are things that may pop up that we're not really sure about, but we will respond as a community and we'll get through it. There's so much evolving on so many different levels. We're trying to learn about what happens after people get vaccinated, whether they can continue to transmit the virus, even though they themselves are vaccinated. They have much less of a chance of getting sick. There's still the possibility that they can harbor the virus and give it to susceptible individuals. And we don't know fully about that, although it does seem like the vaccines are making an impact on that. We don't have the solid information just yet as to be sure. We are trying to better understand how the viruses work in children. There's more of an appreciation for the sickness that the children can have. We've known about very rare cases of severe infection and response to the infection, this very inflammatory response that some children can get that make them very, very sick. It seems that probably was underappreciated and more of an issue in children, but still children relatively, thank goodness, fare better than adults. But again, there's a lot of evolving information there. We're learning more about this long COVID syndrome of symptoms that seem to linger and last well beyond the infection of COVID. And that's something I know that many of you who are living with lupus know very well about, in terms of having many lupus issues and flares, but then after things seemingly calm down in terms of the immune system, you have lingering symptoms, especially fatigue, chronic pain, cognitive issues, focus, mental aspects, things like that. We want to know better about the safety for pregnant and breastfeeding women with the vaccines in particular as well. And there's so many other questions to answer. But we're knocking them down. We're very far from where we were a year ago. So hitting on some of the questions at this point, and I've answered a few already. So are we at the point of recommending people with lupus get vaccinated yet? So I told you the general outline, and we are not at a point where we say people with lupus should get vaccinated, but you're getting the tone of the message that it's probably generally safe for people with autoimmune conditions, including lupus, but you do need to talk to your healthcare team about what that means to you. It does not matter which vaccine. I think the general recommendation is that there's no clear reason to say Moderna over Pfizer or vice versa. And then going down the road, if other vaccines come up, we'll see if there's any clear reason to indicate one over the other given lupus. But I haven't really heard or read anything about that possibility. Clearly, the issue now is more availability. So whatever is available, if you are choosing to get the vaccine, you should get it. And if you prefer Moderna and you get offered Pfizer, it's really in your best interest to get whatever you can get. The side effects are extremely rare. They're similar on both for all the vaccines. And so there's really no difference there. And that shouldn't drive your decision for one or the other. I have not heard any reports of really bad reactions to anybody on immunosuppressant medication or who have had lupus to the vaccine. Obviously, it's very early, but that slide that I showed, that only 10,000ths of 1% went to the ER after getting a vaccine. It's, in general, I think the rate is going to be very, very small, but we do need to keep an eye on cases, and over time, obviously, as people are more eligible with lupus to get the vaccine, the availability goes up, we'll know more about this. So this question about getting vaccine or just a test, I mean, those are two different things. Vaccine is what you get to prevent an infection or reduce the chance of getting infected and having a bad outcome. A test is just determining whether you're infected or not. So very different things. It's not one or the other. They're different questions, really. And we've talked about the vaccine. Do lupus patients qualify to get the COVID vaccine? And as I mentioned, having an autoimmune condition or being immunosuppressed did not prevent people from going into the studies to get those immunizations approved. So when the vaccines come out, if you're in a group that qualifies to get the vaccine, those with lupus should be able to get them if you choose to do so. And yes, you should definitely talk to your healthcare team as to whether your decision is the right one for you. Should people with Plaquenil or Imuran get the vaccine? I think beyond just Plaquenil and Imuran, I think the general question is, how do your other medications for lupus, especially the immunosuppressing medications, factor in to your decision to get a vaccine? And again, going to that general recommendation with the ACIP, there were people who were immunosuppressed, these especially HIV patients that were stable on medications, and they seem to be doing okay. So I think generally the answer to this, especially Plaquenil and Imuran for sure, I think you should be fine if you got the vaccine. Now, I've mentioned before that there are some medications that will probably reduce the effectiveness of the vaccine, especially rituximab or Rituxan and Benlysta or belimumab. And it doesn't mean that the vaccine will have a greater chance of side effects or anything bad will happen. It's just it will reduce the efficacy of the vaccine. And that's something that you need to discuss with your healthcare team as to how best to approach that. If you are somebody who is on those medications or are planning to take those medicines. So again, those are the details that, I can't go through every possibility there. And that's why it's important that you take your individual circumstance to your doctor and healthcare team to talk about that. So what's the protocol for people with lupus to take the COVID-19 vaccine? There is no protocol. You're going to follow the general guidelines from the state health departments. And the state has that 1A, 1B, 1C groups. And when you are in a group that describes you in general, then you would qualify for the vaccine if you can find a place that has availability. And I just talked about lupus medications interfering with the vaccine's effectiveness. There are a couple, at least, and so you need to be discussing that with your team. And there's no preference for Moderna or Pfizer vaccines in general and in people with lupus. So this is just to underscore what you're hearing, and I know it's frustrating for a lot of people. It's just trying to get the vaccine, and it's a matter of time before everybody gets access to it. And we will get to the point where you'll be able to go to the neighborhood drugstore and get one, and you may even be able to choose which type that you get. So that's not too far away, but we definitely need to get the rates of vaccination higher, faster. This is a slide that I saw from a talk that lists some links as to where to get vaccinated in Georgia. I can't vouch for the accuracy of all of the links, but I didn't have time to have it in a way where I can just put it on the chat site. So maybe later, Terry, you can put it up on the website for the LFA Georgia site, or you guys can go back on the recording and take a look at these links as well. Here's another question that was submitted. I'm a patient with a connective tissue disease who would like to receive the COVID vaccine as soon as I'm eligible. I'm also due for my first shingles vaccine. Would there be any significant risk of triggering a lupus flare if I were to go ahead with the first shingles vaccine? If there would only be an interim of a few weeks before I get the first COVID vaccine. With the uncertainty as to when people, because the COVID vaccine right now is on short supply, and there's a lot of uncertainty in sites as to when appointments are opening up. The big question is when you're going to get the COVID vaccine, if you are eligible and you want to get it. So I would focus on that first. The shingles vaccine, you don't have to get right away. It's generally recommended for people 50 and over. It's something, again, that you should discuss with your physician before getting. And I do generally recommend most people with lupus get the shingles vaccine. I've seen some horrible shingles in people with lupus. So I think shingles vaccine is important, but you can get your shingles vaccine pretty easily. The supply is there. The COVID vaccine is it's the highest priority, but it's also the most uncertain. So I would put off the shingles vaccine until you've gotten your COVID vaccine, because once you get the shingles vaccine, you don't want to have the COVID vaccine too close to it. You do want to wait a few weeks, at least 3 or 4 weeks. And why delay the COVID vaccine if you were able to get it, but you can't because you've just recently taken the shingles vaccine? I think it's just throwing too many variables in there. And my general advice for people is to focus on the COVID vaccine if that's what you're open to doing. Could I potentially flare up by delaying the shingles vaccine until several weeks or months after I've completed the COVID vaccine series? The shingles vaccine is okay for people with lupus. The shingles vaccine is probably the most reactogenic vaccine. And for people who've been on previous town halls, that's a term that I've used where you you don't, it's not really a side effect of the vaccine. It's not getting sick from COVID, but it's the activation of the immune system that the vaccine can have in certain people, where people can have symptoms, and it's very transient for a day or two. And this activation is sort of an inflammatory response, and it can give people flu-like symptoms. You can have low-grade fever, achiness, joint pains. You just feel totally wiped out. And that can feel like a flare in certain people. So we don't have reason to believe that the COVID vaccine will necessarily flare people with lupus, but that's what a lot of people do want to study. But most people do not have a strong feeling that it's something that's of a high risk. It needs to be looked at, but we don't think it's going to be that big of a danger in terms of the flare part. But we do know that the shingles vaccine does have this reactogenicity. And actually, I think of it in a good way. You don't want to feel yucky like what I just described and what many of you suffer from a lot from lupus. But it does mean that the vaccine is working. And just because you don't have that after a vaccine doesn't mean that it's not working. It's just that some people's immune systems do respond in a different way. And so a day or two after getting a vaccine, you'll have this reactogenic response where you get this inflammatory symptoms, what I just described, the aching, maybe low-grade fever, joint pains, but it only lasts for a day or two at the most, and it goes away completely. And I got that response from the shingles vaccine, as I've mentioned in the past, and I also got it after my first COVID vaccine. So do not mistake that for a flare of the lupus. And so I wouldn't, I would not think of it that way. But you do want to know that the shingles vaccine and the COVID vaccine can potentially give you some of those symptoms. Most people don't, but they may a day or two after getting the vaccine. So if you were to get any of those vaccines, you want to do it a few days before, a few days before a period of time when you know that if you were feeling a little down, you're able to get some rest and not have any major responsibilities during that time. Just a few more comments on these strains that are going around. The UK variant a few weeks ago was in these states, and Georgia was one of the first to identify it. And now it's spreading throughout the US, and most people feel that it may be the dominant strain in the US in probably the next few months. And it's definitely more transmissible. People get infected a lot easier with this variant. And it could be the source of a new surge given that issue. And so there is a concern, especially in areas like Southern California, where there's been a lot more of these variants discovered compared to some other parts of the country. So it's something that we have to keep an eye on. The thing that we are concerned about is one, things like the UK virus, where it does spread a lot easier. But the other thing that we obviously need to keep a close eye on is whether our treatments and the vaccines are effective against a variants. And the good news is that the current vaccines do seem to mount a good response to the UK variant of the COVID virus. There's another variant that you may have heard about called the South African variant, and has a mutation in the spike protein that may reduce antibody recognition. And what they did was they took convalescent serum from 6 individuals, and what that means is people who have been infected by COVID, and you know that once you get an infection, you have an immunity to that after you've recovered for a certain period of time. So we know this the blood of these individuals who had COVID and fully recovered have antibodies in them. And when they took those antibodies from these recovered COVID individuals, those antibodies did not neutralize the South African variant of the virus, as well as other strains. So it makes us a bit concerned that the vaccine may not be as effective. The vaccine experts, from what I understand, don't think that these changes in these mutations in the spike protein that the South African variant has will completely reduce the efficacy of the vaccine. But given what we're seeing in these neutralizing antibody studies and the fact that these mutations are occurring in the spike protein, it is something that makes us concerned that there may be some reduced efficacy of some of the vaccines in strands like this. But the other thing to remember, though, is that we expect this. I mean, this happens all the time in viruses. That's why we have to get a different flu shot every year, because the virus strain mutates and changes, and based on its characteristic, the one that is the most infectious, that spreads around the humans easier, that one becomes the dominant one that spreads around the world, and we change the vaccine accordingly. So even though these headlines can seem very scary, know that this is par for the course when you're dealing with a virus. And so, yes, we do need to watch this, but we are prepared for this, and vaccines can be adapted and changed if, God forbid, things were to get to the point where the vaccines are not nearly as effective as we want them to be. And this is another reminder that this issue of the pandemic and COVID, and I mentioned this also in the past, it's not going to go away because of a vaccine, or once 70% of the population gets vaccinated. COVID is going to stick around like the flu virus and the common cold. And I'm doing some additional reading about this flu pandemic that was in the early 1900s that we read about, the last major pandemic in the world. Apparently that strain is still floating around, and that's because it's just over time never gone away. It mutates. It's not as effective in terms of causing harm to people as it did over time. People develop immunity over time, and so that's how humans adapt and viruses adapt. The thing to remember about viruses and mutations is that mutations occur when people get infected. The more the virus replicates, the more it travels to other people, the more chances it has to develop mutations. And so, that's why the masking issue, the prevention of spread, that's the other important thing that we need to do. The less we have infections, the less mutations occur, the less chance of having strains come out that are problematic. This is a detailed slide. I just kind of briefly put it up for people who are in the know and want to know more information about these different variants. But I won't go into detail. I've discussed the major important parts of it. So here I'm going to end, I think, with a couple questions. I have had Cytoxan and recently cyberknife radiation. Should I get vaccinated? That's a question that you need to discuss with your healthcare team. I can't answer such an individualized and specific question. This point about I have not done flu shots and have yet to get the flu, it's, I'll phrase it sort of a different way to think about it. Some people can say, well, why am I putting on a seatbelt if I've never been in a rollover car accident? Well, the point is, God forbid if you were in one, you don't wait to be in one to then click your seatbelt. And so, the point about vaccinations is not necessarily whether you've been infected with that or not, but it's really the risk and benefit from the vaccine. And the risk of getting the COVID virus, especially in people who are immunosuppressed and have other comorbidities. And you look at what can happen to certain people. Yes, most people recover from COVID, but this is far from the flu. Remember in the early days when people said, oh, this is just like the flu, people die from the flu all the time, but we don't make a big deal of it. Well, did you know in 2020, this past year, COVID, even though the pandemic really started kicking in, not from the very beginning of the year, but towards the middle of the year, even with that late start, it was the third leading cause of death in the US. And currently into 2021, COVID is the number one cause of death in the US. So, don't tell me it's the flu. This is a lot more than that. And the flu hasn't overwhelmed hospitals and have put people in gurneys in the hallway and have had certain hospitals choose to give life support to one person versus another because they don't have enough units. That's never happened with the flu. So this whole rationale about not having the flu before and getting the flu shot, I would take that out and really think about the risk of getting COVID. And the thing about traveling one day and life as usual, it, we can get there, and it's going to take some time before travel is normalized, whatever that's going to be. But it will definitely be more normal than it is now, and it's going to take time. It's going to take vaccination on a global level, but we will get there, and there will be some bumps along the road. But I have full expectation to travel with my kids and family at some time in the future. And along the way, I think people can make um, their own decisions as to what kind of trips they'll take and the risks that they're willing to take. But we'll get there. I am now hearing that there's a recommendation to double mask in certain situation. I've never heard of that. Don't listen to that. Uh, Masks were never designed to be doubled up. And so when you double up even an N95 mask, you don't get double the protection. In fact, I'm concerned about how uncomfortable it'll be. It won't allow people to wear it for a long period of time. It may interfere with the fit of the mask below it in terms of having another mask in there. There's no situation that I've ever heard of or read of where you need to double up. If you need to double up on a mask, that means that your mask that you were wearing to begin with was not good enough. And so we've talked in the past about different types of masks. You don't want to wear a bandana. That's probably the worst thing, just like a layer of cloth. You want multiple layers of cloth would be much better. I think that's sufficient enough. If you practice social distancing on top of that, those are extremely effective. If you have access to a KN95, then obviously that's even a higher level. But I don't think you really need that if you're able to get some distance and have a multi-layered cloth mask with a good fit around your nose and your mouth. The last thing I'll mention here is just for you all to remember when when you advocate, and I hope that we all realize the power of being advocates. not for ourselves only, but also advocating for one's health on a political level. And I'll just throw this out: public health is shocking. It's not a priority in Georgia, even despite being in a pandemic. And currently, the budgets are being thrown out in the state. And you would think, being in a pandemic and the issues that we have with the public health infrastructure, that we would be willing to put some more support into it. But really, the increase in the budget for the Department of Public Health is originally proposed to be just less than $1 million in a budget that is, several hundred millions of dollars. I mean, the incremental increase is a drop in the bucket, and it's a shame. So I hope that we can all remain together and fight together for our community and for um, lupus as a whole, but also for all of our communities, our neighbors, our family members. And we're all in it together in this state. And if we don't have proper infrastructure, especially in public health, I mean, I don't know what else we can do to demonstrate the importance of this. So thank you, Terry, and the rest of the staff at the Georgia chapter of the LFA. Please continue to visit the resources there. Please send your questions if you are able to by next week, and I'll address them in the talk. I'm just not going to be able to get to the chat questions this week. I'm sorry, I went a little bit long for my schedule. So please continue to go to the Georgia chapter website. The National Lupus Foundation of America has resources about the vaccine and lupus as well. And please do send your questions and your comments and suggestions to Terry through this email address. And please be safe and continue to take care of yourself, and we'll keep walking together. Thank you for your time and your attention.